Hi guys, it is Dr. Scott Dixon. I'm the owner of Athletic Dry Needling, and I am here with Dr. Matt and Dr. Addie, owner of Performance Wellness Chiropractic. So what I want to really do, the reason we started this podcast is I've had the opportunity in my travels to meet some amazing clinicians, and after meeting you guys, I really want to hear what got you to this point. So Matt, if you want to start, kind of tell me your journey up until you guys kind of started business together.
Yeah.
And what really made you want to be in chiropractic?
It was kind of a roundabout road for me. Started in sports young, early, high school. Got the fortunate opportunity to play college football for University of Colorado. Was always interested in sports and training and weightlifting.
Right.
And I grew up in the Western medicine world. So my idea when I went to college was basically to go to med school. Right.
Okay.
So tested through all that, did well enough to basically go overseas or go in the Caribbean. Felt that wasn't the right path. So fell back into weight training, decided to become a strength and conditioning coach, got an internship over at USF in Tampa. Had some great mentors, met some good friends there. Started to work with the Pittsburgh Pirates in their spring training facility and quickly realized that I didn't like baseball. And it was a lot of time and I was getting paid almost nothing. And to make some money in that realm, I either had to either own my own facility or become a head guy. And that there's the time, and I didn't feel like I wanted to travel because of the sports team. If they change leadership, you're basically out of a job and you're moving to a new city. So talking with my family and with a good buddy of mine who's a chiropractor in Fort Myers, we ended up finding chiropractic school and realized that I could do the tissue work and I could do the strength conditioning and the rehab and also learn how to do some manipulation and make it was all within our scope of practice to kind of make this our own little realm.
Okay. And how long ago was that?
That was...
We started in 2012. April 2012 was the start.
Yeah, so this is our 10th year in practice. Okay. So then, yeah, 12 years ago.
Okay. All right. And you went to where?
For chiropractic school?
Yeah.
Palmer College of Chiropractic.
Okay.
That's actually where we met.
Oh, nice. Okay.
In the Florida campus. Yeah,
Excellent.
like South
Okay.
Daytona area.
Okay, so tell me your story up until chiropractic school.
My story is a little bit different. I grew up going to a chiropractor. My mom worked for a chiropractor since I was little. I grew up only knowing that Palmer was a chiropractic school. I didn't apply to anywhere else. When we went to chiropractic school, everyone was like, "Where'd you apply?" And I was like, "I thought this was the only chiropractic school out there." I knew I loved science. Going through like elementary school and middle school and high school, I knew I wanted to be in the healthcare field. Okay. So I took a pre-med route in college. And during my time, even in high school, I started doing internships with chiropractors, physical therapists. I got my first injury like senior year, and I went to physical therapy and like actually got that kind of route going. And then when I was in college, I did so many different things within the medical like field of interning, volunteering, just to kind of see where I wanted to be and what I wanted to do. I was in the cardiac cath lab for a little while, realized very quickly like the hospital and that type of work was like not what I wanted at all. There was very little patient interactions with the doctors, with the patient. The nurses were doing a ton more of the patient interaction, but I didn't think nursing was exactly where I wanted to be. Then I did an internship with a holistic MD just south of here, actually, while I was in college, and I got my phlebotomy certification. This was, well, maybe like 14 years ago at this point. So functional medicine wasn't really the term back then, but that's basically what she did. IV nutrition therapy and nutraceuticals and all that stuff. So I helped a lot with all of that and I loved it. And then it was like, take the MCAT and go the MD route or go into chiropractic and like do the DC route. And it took me a really long time to kind of figure out what I wanted to do because what I thought about chiropractic was very different than what I realized chiropractic was in school. Because I was only introduced to one thing, but I didn't know that we took a PT board and we could do physical therapy too. I didn't know that there were so many different techniques in chiropractic. I didn't know the foundation like in nutrition and just like general holistic health. I knew chiropractors were holistic, but the extent of that, I was very limited. So when I got to chiropractic school, and there were so many other doors that kind of opened up from that route in terms of like health and life and all of that, I was just was immediately confirmed that I had chosen the right path. So that's kind of how I got there.
And then once you graduated, what was your first path?
First path, well, my goal was always to open up a practice on
I
my
mean, you
own.
knew that the whole time.
Yeah, and then so that was right out of school. That was the goal, right? So getting your license, looking for spaces to go.
So you never worked for someone else?
No.
Oh, wow. Okay.
She, as we talked earlier, she spent some time with Dr. Keith as we're kind of getting things going. That was her preceptor. My preceptor was Dr. Robin down in Boca.
Okay. So, two good people.
Yeah, absolutely. And then so we found space through a gym I grew up working out at down in Wellington. So we started there. And then Dr. Keith's friend, Dr. Campbell up here, was nice enough to lend us his office 3 days a week. So 3 days a week, we're up here in Gardens, 2 days a week down there, and then taking whatever we could get. So house calls, traveling here, traveling there.
Okay.
So
hustling.
Hustling, yeah. And even if we didn't have patients, like somewhat eye-opening, but kind of expected. Like you open your own practice day one, you're like, all right, where's the patients at? And there's nobody, right? Even if you have an office, you're just kind of sitting there.
Yeah.
So I made it a point at literally like a work day, 8 to 5. I'd be out the door by 8, and that would just my niche.
Regardless of whether you had patients.
No patients or not. So I was out on the road, and it was basically my niche was the gym. I was very comfortable. I could speak the language. I could go in and teach them how to lift and all that kind of stuff. So I just Google, find a gym, and just do circles and circles and circles and a lot of no's. And then, all right, next day, same thing, circles, circles, circles. So and one of the gyms here we've done the most work with, it probably took me, probably 6 months. No, I don't need you. No, I don't need you. And then finally, like, yeah, you can do a seminar. And then it was like, click, all right, you're in.
Yeah.
So,
but a couple of those gyms that we started with, Steve Gym and Nick's Gym and all that, they're still great patients of ours and friends now because we've been in practice for 9 years.
Yeah.
Yeah. It took a lot of work in the beginning. I honestly was terrible at that part.
Okay.
I definitely go into like the freeze and fawn of when you're nervous. And I was kind of paralyzed at that point in our.
And I'm not a big talker, but for whatever reason, that setting, I'm very comfortable. I can just go. Yeah.
You got the personality.
I was not. I was like, I don't look the part. Like I know the biomechanics and stuff, but no one wants to listen to me. Like I had very little confidence. I knew that I knew it, but I had very little confidence in like portraying it. And I was like, this is your like wheelhouse. And
That's awesome.
they want to listen to you talk. They don't want to listen to me talk. So, but I definitely found my niche along the way. But that was definitely a point of contention for us in the beginning. Like we found our roles very quickly.
Yeah, I can see that. I like that.
Yeah. And it was hard, but once we kind of made that transition and realized like, he was good at one thing and I was good at another. Like we didn't really fight each other on it anymore. We kind of just fell into our roles there, which was tough, but we found it pretty early on.
I think I remember from when I was here 2 weeks ago that there was kind of a challenging space prior that was, I think you guys, the other space you were at here before here.
Mm-hmm.
Was that? Tell me about.
We talk about, was it the one, like the gym and the 2 spaces splitting or the one?
No, the one that was, you said it was kind of almost underground.
Oh, yeah. So the gym we worked at, which I grew up going to in high school, it was a great gym. The space they offered to us, it was just, they were just taking a percentage. So if we didn't see anybody, there was no harm, no foul. So we figured it'd be a good place to start. It was literally, it was a back room, but the back room was out the back door. So we have to take our patients from the front desk, parade them through the gym. And sometimes there's guys in like walkers, wheelchairs, they can't stand up. And it's like, I'm sorry, no, we got to walk to the back. And they're like, where are we going? Like out the back door. It's like emergency exit, like big
where the
red lines.
dumpsters are. Like, don't go out this door.
And you open the door and there's just like parking lot. You're like, okay, like we're going to the left. And then there's this giant smelly dumpster. And then you're going in this back door. And then there's all the way in the back. And it's just like a little drywall room. So it was a process, but we made it work.
Yes.
Yeah.
We were really fortunate to start out
both in that?
the way we were.
Yeah. We were just taking depending on who they wanted to see. So.
And then we were, at that point, we were like, oh, we're going to be down south Tuesday and Thursday. And then we're going to be up north Monday, Wednesday, Friday. But then you don't have patients, and the patients you do have are like, well, I can only come in this day down here. So we're like, okay, I don't really have anything to do. So I'll meet you where you're at, and like, I'll come treat you. And then it started, we got a little busier. So it was like Wellington Gardens, like 3 to 4 times in a day. And then we would start, there would be traffic and we would be late, and we're like, this isn't working.
And we'll go into this a little more, but initially, when you were doing that aspect, it was cash only.
Yeah, started as cash only. Okay. Yeah, and then Transition to insurance just because we were getting phone calls, which
Yeah.
as a new practitioner is frustrating when you get a phone call and they say, "Oh, do you take so-and-so insurance?" And you say, "No," or whatever spiel that you use, and
Yeah.
you just hear click, like
Yeah.
not even like a question. So
And then when we did try to get with insurance, though, it was your area is too saturated. You have to be in practice with it like for 5 years
Right.
before you can be with us, and it just wasn't really worth the fight for a lot of that. Plus, it was just us, so like
Right.
we were calling. You'd spend hours just to find their benefits and what their copay is, and then they'd come in and they'd be like, "Well, at my other chiropractor, my copay was this." And I'm like, well, I just called them
Yeah.
and I don't know, like, so that ended pretty quickly because we were just like, we're wasting so much time on the phone
Right.
with these people and we're not able to give the care that we want. They're dictating our care, even if their insurance company, they're paying for it. They offer them 30 plus visits a year or whatever. We would have to send in letters after 5 visits, telling them why we needed them to continue care. And it's like, it's their plan. They already
Right.
have it. Why are we writing these
Right.
letters?
To
Because
prove it.
they want chiropractic care like to establish a medical necessity. Well, there's a point at which chiropractic care is also wellness
Yeah.
care and maintenance and
Agreed.
things like that. And so we don't want to like lie and say they're in, acute
Right.
pain right now and they need to continue care when they're actually doing pretty well, but they want to continue care because they've been feeling
wanna keep
great
doing
and
well.
they don't want to
Good.
fall back to where
Right.
they were. Is it as frequent? No. Does it look different? Yes, definitely. Like everyone has their own thing, but we're like, this isn't right. We don't
Yeah.
want a third party payer dictating our patients' care when they don't even know who they are.
Right. So what I'm most excited is what we talked about when I'm here is really the transition to this place. 'Cause
Yeah.
This is what, not only the way you guys practice and your mindsets, but the setup, the way you treat, the way you are with patients, the way you are with everybody
Yeah.
that comes in here. I want to kind of dive into that because I think that's what people really want to know
Yeah.
that are interested, because it's one of those PTs as well. It's one of those professions. You Google it, and I don't think they get what I'm getting.
Yeah.
Right. So I think if we could go into kind of what led to this building,
Yeah.
and explain your styles of treatment a little
Yeah.
bit more, why you do the way you do it. That's
Yeah.
I mean, I think the goal, and even when I was working in the gyms as well, like the goal
Yeah.
was always, in my mind, was to teach.
yeah. Okay.
I kind of felt that the more the patient or the client understood about why they were doing what they were doing,
Yep.
and even just their own body, the easier it was on them. So they don't have to become as reliant on me.
Yes, I love
right?
that.
And then also too, they just understand more so they can advance their own treatment. And when they do come in to see someone like
Yeah.
us, they can say, I did this hurt, this made it feel better, it kind of hurts here, it doesn't hurt here, versus
Right.
like my leg hurts, fix
Right.
it. Then you have to go through your whole diagnostic process. It just takes a little bit longer for that.
Right. Okay.
So the goal is always to teach. And because of that, we kind of migrated towards longer patient visits,
Yeah.
20, 30 minutes.
Nice.
There's just a lot of patient education. Like even we have patients that come in with images or they've seen somebody else. We ask them, well, what they tell you? And they say, well, that's what this means to us. Or if they have a report, we'll say, did they go over it with you? And most of the time it's like,
Yep.
no. Like, do you
Mm.
understand this language? No. All right, well, let's go over here and we're going to talk
Yeah.
you through the whole thing. This is what it is. This is why it happens. This is why it gets worse when you do X. This is why it feels better when you do Y. And that's a good portion of our, we do the treatment as well, but I think the more important part and like the buy-in for most of our patients and the reason they come back is because they understand why they're getting what they're getting done in the office and why they're getting better or why they may be getting worse.
I think
So,
that's huge because a lot of people, especially as a new business, want to create the mindset that, hey, you can't be successful without my magic hands or my magic, right? And versus empowering them
Yeah.
to
I was
take
just
care of
gonna
their,
say- I was
That's
just going to,
huge.
we really try to empower the patient because they live in their body. I mean, we live in a society where everyone's always telling you like, you need this, don't do this. Like, and people are like, I don't even know what to think about anymore because I was told that this is great for me. And it's like, it may be great for some people, but if it's not resonating well with you, if it's not serving
Right.
you, then don't do it.
Right.
So giving the power back to the patient and not letting them just identify with whatever diagnosis
Right.
they've been given.
Oh, that's
Um,
huge.
Because pain and injury, there's so many different factors involved with it, like so many factors that a lot of times when they go get an MRI and they've been told that they have degenerative joint disease. Okay, that's definitely a diagnosis, but
Right.
it's not telling you why there's pain. It's not telling you how that pain like came to be. It's not telling you how
Right.
that degeneration came to be. You can have so many different people, and we've seen it in different MRI studies that people are walking around with herniated discs and they have no pain, where people can be walking around with no herniated discs and have tons of pain, like debilitating pain. So taking into consideration all the factors of that individual person really is huge. You know, we get people come in, like say with knee pain, and we talk about their hip, and they're like, I've been to so many orthopedics, and I've been to, you know, PTs, and I've been to this and that, and no one's ever talked about my hip. And it's like, well, where do all the muscles that cross your knee joint originate?
Right.
In the pelvis somewhere. So let's talk about your hip and your core and the whole kinetic chain.
A favorite quote I like, I think, I forget where I saw it, but basically if you tell someone they have degenerative disc disease, it's like telling them they have wrinkles on their face.
I think it was Stuart. McGill.
Yeah.
He was like, that's like telling my mother-in-law she has wrinkles.
Yeah, and there's been a lot of proof out there that people, like you can see somebody walk in a place with a little bit of knee pain, and then they get imaging like, oh, I have knee OA. And they're like limping a little bit more on the way out because they like you said, identify. I like that word.
Yeah.
They're like, oh, now I have knee OA.
Arthritis is one of my favorites. But like, I got diagnosed with arthritis, and I was like, oh, well, what hurts? My knee hurts. I was like, that's great. You just spend a lot of money for them to tell you in Latin that your knee hurts because arthro means joint, itis means pain. So you told them you had joint pain, they told you another term for it.
Inflammation in your knee, and then it's like, okay, well, you walk the same on both feet. Like, say it's someone who's not necessarily like a unilateral sports athlete, right?
Yeah.
They're walking on their legs the same. Even if they're running, they should be running on their legs the same. So why isn't one side wearing like the other?
Yeah.
What does that look like? And they're like, oh, I never thought about that. It's like, you got two legs. Why is one different than the other? What's your gait pattern like? What are your daily activities like where you're leaning on one side more than the other, or carrying kids or your bags or whatever it is you do? We tend to all fall into these asymmetrical patterns
So it kind of explained to me the evolution of this place of performance.
Yeah. So we started in the gym and then the office running space. Yep. We grew enough to eventually get our own, rent our own, which was actually across the street, about 900 feet. We just kind of continued to do our thing. It was mostly just the two of us. We were both here 5 days a week.
Oh, wow.
And then we got married, started to have some kids, and she had to take some time off. Obviously, thankful for taking care of the kids. Appreciative, very appreciative.
There's words of affirmation.
Growing tiny humans and birthing them.
Yeah. So around that time, we started to add some staff because I needed some help. We were getting busier, so we brought on our office manager.
We love you, Kelsey.
We just kind of kept doing our thing. It was slow growth. I mean, we were just cash based, frustrating at times, but
it was enough because I work with a lot of cash PTs. It was enough where you neither one of you were side hustling. Like this was your income.
Yeah, when we first started, I was coaching a swim team. I was helping coach kickers.
When you were at that office by yourselves, there was no other job.
No.
You were making enough.
That was the office point.
I did a couple, like some house visits that were consistent, like weekly, because I, had more time in the office. So I had the opportunity to make those drives and stuff like that. But yeah, we were kind of done with the side hustles at that point. Mm-hmm. And you started working with the soccer team. So I don't know if we'd consider that a side hustle because he was like out of the office and I would have to take over for his patients. But that was another step, like with exposure and different clientele and experience.
Too. It was a great experience. Absolutely. Yeah.
And then how long, I know you mentioned both this week and last week, how long have you been in this?
About 2 years.
2 years? Okay.
Yeah. So this October started our year 10 in practice.
Okay.
So it took us about 8 years to get to this. And we were able to we were renting space over there. We actually were able to buy and renovate this and kind of make it how we wanted. So
I mean, it's amazing. The setup is perfect.
Thank you.
It's
And
coming
then
really
you
well.
brought in Vincent?
Brought in Dr. Vincent. Yeah. He's been with us for just over a year now.
Okay.
So.
And he's doing well?
He's doing well. He was a former intern. We've had a couple interns through the years, but Dr. Vincent was one that kind of stuck out. And it was the right place, kind of right time. We were looking to take that next step to bring somebody on.
And you feel like the mindset that he has towards patients, goes along with what you believe. And
very similar. His approach to patient care and how he goes about it, and his empathy and his actual just like genuine care for like helping people.
Yeah.
I think you can always see that, and it makes a difference to the patients. Like when you can actually have a conversation with them, and it's not just about like biomechanics and that sort of stuff, but you actually create a relationship with your patient. I mean, that's a huge thing that a lot of traditional like doctors' offices don't have. You're on a time limit of, I don't know, sometimes 5 minutes, sometimes 10 minutes, but like we know people's like grandkids, and we know like all these things about them, and you create a big relationship with them, and you want to see them flourish, and they want to know about you, and so it's more of like a family and friends, and that's the kind of vibe. And we were talking about it with someone before. We were like, it's kind of like the Cheers vibe, where you come in and everyone knows your name because this one's like, oh, hey, like, hey, neighbor, like some.
Like I had a patient on earlier this week who they haven't seen each other in probably 2 years. And they were like best friends in college. And just like passing enough. She's like, hey, what are you doing here? Hey, great to see you.
And it shows the 6 degrees of separation, really, of like the community and how like-minded people kind of end up in similar spaces. And
like attracts like.
Yeah. And that's really another reason why we didn't try to force. We had told you earlier, we'd never done marketing, but like at all. We tried a little bit earlier in the year and it blew up in our faces. But it was like, and then our accountant was like, go back to what you know. Like it's gotten you this far. And that's how we've grown, is through people, like word of mouth, people telling other people. And it brings in the patients that do the best because they're like you said, similar, like-minded, have an expectation.
With you guys, it's the combination. There's a lot of people who have the personality and like, hey, come in, it's great. But then they don't have the knowledge. You guys have the knowledge to get people better, and the personality. A lot of times you'll get a really good surgeon who's kind of a jerk, right? It's amazing you guys are both really smart and passionate about what you do from a knowledge, but also passionate about people.
Yeah.
I think that's huge.
Hard to find.
Yeah. So kind of what's the next couple of years look like?
That's a good question.
Performance wellness going to be?
Well, I think the reason that we named it Performance Wellness is we want like an all-encompassing place, right? So obviously chiropractic is the core and it's kind of what's gotten us to this point. But I think now with the new space, we have the option to start to expand that wellness side more often, right? So we've got the cold tub and the sauna and the red light. We're expanding into dry needling, which is something we want to do for a long time. Just more methods to basically create almost like the idea would be like a one-stop shop for the patient, right? So minus a few different things they may be looking for, they can come here and get all things wellness, feel right, get fixed up, and kind of have a better life.
You ever get to the point, just curious, where there's going to be someone who's not with somebody, like working, they can come work out?
That would be ideal.
Okay.
Yeah.
We have discussed it. There's different, pros and cons to it. We want to make it work because we do a lot of rehab, personal training, and things like that. And although our space is 2 times the size of what we had before, it just doesn't quite accommodate
people working
that. And we want to be able to give priority to the people who are doing the personal training or the rehab or the one-on-one sessions, and not kind of, I don't want to say competing, but if somebody's using, when we only have one rack, right? So if someone's using that, we can't use it. We have one sled. So if someone's using that, we can't use it. So we want to be fair to everyone involved, of like just equipment wise and time wise. But there was a little while where we were talking about like small group classes, things like that, to accommodate more people and just get quality movement in, right? It's hard to, in big group fitness classes, it's hard to get everybody's individualistic needs met. And our goal isn't to have you here the whole time. It's to teach you about your body so that when you do go back into your group class, or while you're continuing your group classes or in the gym by yourself, you can be like, oh, that didn't quite feel right. Let me make sure, I'm breathing properly, or reset the rib cage. Let me make sure I'm hinging right. Like, just let me reset, because something doesn't quite feel right. Instead of, most of the time people are like, I'm just going to power through. It hurts, but like, I want to get it done. And so we want to give you the knowledge and space to create that intention around movement rather than just getting sweaty.
I really love that you guys, you've stressed it many times, we're not like, hey, people got to come to us for years. They do it because they love you, but you're like, hey, let me fix you and then show you how to move, show you how to learn about your body, go work out, go back to life. If something comes up, come back to us. But it's not like, hey, if you come to me twice a week for 6 years, you'll be good. Right?
I mean, there are patients that do better with, weekly visits. We work on different things depending on what their issues are. There are some patients who do better with monthly visits. There's, most people want to come because they do feel better. It's not because, like you go to the dentist when you don't need to, right? You go get your oil changed before your car actually breaks down.
Agreed. I like that.
So that's kind of what we're here for. If you have a tweak or something, you're like, this just doesn't feel right. It was feeling fine, but like, what am I doing wrong? Okay, let's load up the barbell and see where we're going wrong. Oh, did you think about this and this? I'm like, oh, I totally forgot about that part. Now you can go through.
I think when I phrased it, it was wrong, because a lot of people it's like, let me be broken and then go to Piker. I think because you pre-educate them on when the light comes on in your car.
Yeah.
Not broken, but hey.
Something
When it's yellow, you kind of need to go before it turns red.
That's what
and
you
you're
guys are
on the
good at.
side
Let's
of the
get you
road.
come in. I know your squats aren't hurting, but they don't feel right. Let's look at them.
Yeah.
You know, I love that. I love that aspect.
I think that's what chiropractic or just any physical therapy care is meant for is that maintenance, right? We're very good at pain management. We can find the source and usually get you feeling better very fast. But I think the idea is to keep that steady, I feel good all year round versus this like high, low kind of
I'm
wave
hurting,
that you're
let
riding.
me see. And again, I think it's not only history, but it's that kind of the Western medical. I'm going to hurt until I go to my doctor. He tells me what to do. I'm going to hurt again. Versus, no, you can.
Or the answer becomes just don't do that anymore. That's off the table. You can't do those
or
things.
Here, take the medicine or take. Versus, I keep going back to it, that patient education, that empowering.
Yeah.
I think that's the most powerful word. So because we're here in a dry needling class, kind of, how do you see that implementing in your business? You know, I mean, have you thought about things like price? You don't have to mention it on here, but have you thought about how, if you've got a full load, you got a full load.
Yeah.
Yeah.
How is needling going to be implemented?
Yeah. It gives us, it gives us another option. Things I've seen personally, just in the course this weekend and the last time we were here as well. It gives us the option to get a little bit deeper. So certain tissues or structures that, either we have to beat up our hands or it's like 15 minutes of scraping or cupping to try and get some change. It's almost instant if you can get to the right spot. So like through you helping us to like hone in on our anatomy, there's results I've seen almost instantly once the needle gets to that spot that have helped tremendously. So there's already certain patients we can, that I've been thinking about that like, I know this is going to be like a game changer. Like they've had these lingering things that we get better, but I kind of keep coming back. But I think this will just send them to the next level, which I'm extremely excited
Do you
about.
think you'll kind of do it in like one of your treatment sessions?
We've been talking about that. I think with the way the practice is set up now,
I don't
just
think
as
we're quite ready.
As we get more proficient with it.
Yeah.
So it'll probably be like a separate session, just to give us time to make sure we're doing it correctly versus trying to rush through it.
Okay.
So we'll probably keep it separate.
Right. From the cool thing that I've learned, like as traveling across the country, is that it's so effective that you'll see people come in and go, how much for just that? Like you'll have like a separate. There were people going and like, I felt good with the corrective exercise and I felt good with the manipulation, but that needle is really cool. Can I just do needle? And then you get them on something where your needle next week, you with all the chiropractic care next week. And
that's kind of what we want to do. I mean, and plus too, like you can always add more. It's hard to scale back, right? So like if you do the cupping and the Graston and the dry needling and the adjustment and the corrective exercise, like it could be too much and, people are hesitant to come back. Two, you don't know what worked, right? Like they're like, that was great. And we don't just want to dump everything on you. Cause that's not a great, a great
and
philosophy.
I know you, because I've heard it. People have come to me and go, what did they do? And they literally start going through all the modalities. Right, what helped?
And we have with patients tried various things because they respond in this area to this, or they respond to this, or, we definitely go through and try not to like reinvent the wheel. But if someone's responding to something or they're not responding like we think they should, we're not going to just do the same thing over and over again.
I think that's one of the cool things. And I want to make sure everyone knows that. It's just how, when you look at the courses you take and how diverse you both are. There's an old saying that when you're a hammer, the whole world's a nail. Like you guys have full tool belt. Like you're not, okay, I'm a chiropractor, I'm going to, well, that didn't work. I'm going to manip again. You're like, well, that didn't work. I've got this, I've got that. I've got so many things that I know could help you. Right.
And as a chiropractor, our chiropractic adjustment is one of the biggest tools in our tool belt. Your innate healing ability, your body's innate ability to just flourish and prosper and want to be in homeostasis is there. We want to support that so much. But there's also people who, for whatever reason, are hesitant to chiropractic care. I've heard so many different reasons. I don't even need to get into all of them, but what they're doing with their MD or their DO isn't working, and they don't have like a middle ground. They've done PT, and it didn't really work for them, which I'm not saying is but people have been to chiropractors and it didn't work for them. They come
in probably 10 years.
But they just don't know where to turn and they don't want to go on medication and things like that. So being able to offer them alternative ways to adjust, but two, the soft tissue, the cupping, the corrective exercises, just like biomechanic knowledge, things like that. Again, empowering the patient. It doesn't have to be all or nothing. It doesn't have to be whatever you think it is. It doesn't have to be that way. So your expectations of what you think we're going to tell you may not be that.
I like that. So really quick, because we don't want to keep him too late. So just so we can get information, because I want to help out those. For my company, it's athleticdryneedling.net. Emails athleticdryneedling@gmail.com. You can look us up. We do dry needling, spinal manipulation, and we have a ton of online courses. You guys can kind of tell people
You're
where
based
to
in
get hold of
Jacksonville,
you.
right?
What's that?
Based in Jacksonville, right?
Based in Ponte Vedra. I don't know.
Yeah.
Ponte Vedra. More bougie than Jackson.
We are performance and wellness chiropractic.com. Instagram, we're PWC Chiro.
Performance and Wellness.
Performance and Wellness Chiro.
Okay.
That's our other.
Okay, that's the one that's a secret. That's where the bloopers are shown.
Yeah. And we're based in Palm Beach Gardens, Florida.
Excellent.
Yeah.
Cool. Well, I appreciate you guys.
Yeah,
Thank you so much. Yeah.
It was
Thank
great
you.
to meet you. Thank you.
Yeah.